Hi, I'm Nat from PACOP, and today on PACOP Clinical Bites, we are going to be looking at the Problem Severity Score. The Problem Severity Score, or the PSS for short, is one of the suite of assessment tools that we use in PACOP. The PSS is a clinician-rated tool. That means that these assessments for this tool are to be done by the healthcare professional, probably the nurse, but any healthcare professional can use this tool. It measures symptoms or problems across 4 domains. 4 domains are pain, other, psychological, spiritual, and family carer. And it measures them over the past 24 hours. Let's talk about the 4 domains. First of all, a domain is a whole area of problems that come under one heading. So when we're looking at pain, for instance, we're talking about pain anywhere, any type of pain, verbalized or non-verbal signs of pain. When we talk about psychological or spiritual domain, we're talking about anything that falls into this category that relates to the resident. That can be anything related to their religious beliefs, their spiritual beliefs, or their psychological and mental well-being. This includes depression, anxiety, severe worry, anything that fits within this domain. Other, we're talking about anything at all that doesn't fit into the other 3 domains. And family carer domain, in this domain, we assess any issues or problems relating to the family or carer of the resident that are to do with the condition of the resident. The problem severity scale operates on a numerical scale of 0 to 3, with 0 being absent, 1 being mild, 2 being moderate, and 3 being severe. And when you rate the problem severity score, remember you are rating it for these domains over the past 24 hours. Also, because these are domain tools, you may need to document further in the notes what it is that you have rated within that domain. For instance, if you were rating something in the pain domain and you gave it a 2, you would want to put something in the clinical notes to indicate where the pain was. It may be more than one site, and your usual pain assessment will follow on from that. What type of pain? Does it radiate? Does it come and go? Is it sharp? All that type of thing. And also, if you were going to use the psychological spiritual domain, for instance, and you had a rating in that of severe, you would need to put something in the clinical notes to indicate what it was in that domain that you were concerned about, whether it be a depression, whether it be something relating to their religious beliefs and their need for them to see perhaps their church priest immediately, whatever it is, you need to give further information in the corresponding clinical notes. And that is because these are domains. If you assess any of these domains and there is an absent problem, you put 0. However, if you don't assess any of these domains for whatever reason, put NA to indicate not assessed. Don't put a 0 because then we will think that it has been assessed and the problem was absent. So if you're not assessing, remember, put NA, not 0. The problem severity score is a great tool and it's great for clinicians to use because they can use their clinical skills and clinical judgment to really assess the resident. And within the 4 domains, there is space for them to assess anything at all. Anything of concern, anything that clinician thinks needs to be assessed can be fit into one of the 4 domains. The other great thing about the problem severity score is that it works really well with the SAS. So the SAS, as you probably already know, gives the residents distress scores. Any symptom or problem that is of concern to the resident is rated in the SAS score, whereas the problem severity score is rated by the clinician. So together you can get a really good picture of what is of concern or an issue for the resident by using both of these tool scores together, and then we can provide a really holistic care plan to address all the symptoms and problems for that resident. Just remember, the problem severity score is a clinician-rated tool. It's a domain tool, and it works great when you use it together with the SAS. Thanks for watching this PACOP Clinical Bite. We have many more PACOP Clinical Bites that I hope you'll go ahead and watch. And if you need any information about anything relating to PACOP, please contact us here at PACOP and we will be really happy to help.